Today I'm meeting with George Limberakis, an LCMHC, and I'll let him explain what that is, as well as what E.F.T is, because that's what we're going to talk about today. But, as we normally do, before we start, could you give everybody who's watching your contact information for those who would like to contact you later?
Sure. My phone number is probably the easiest way to get a hold of me. That's 801-487-4298. You can reach me via my website also. It's georgelimberakis.com, just as it sounds. Limberakis.
All right. So, what are we talking about today? You told me before we went on camera we were going to talk about E.F.T, and I do know a little bit about it, I got to be honest, but I didn't know anything beforehand, and it was quite interesting. And I think you're going to find this very interesting as you listen and as you subscribe, which I did, and I can't wait to hear more of what we're going to talk about. So take it away.
All right. So E.F.T is emotional freedom techniques, and it's a branch of energy psychology. So it's kind of strange stuff, and I started out and still am a cognitive behavioral therapist. Cognitive behavioral therapy is about how we think and how we behave and how those things come to impact our lives. So E.F.T. Involves a bit of cognitive behavioral therapy. It's based on the Chinese meridian system. Actually, the meridian system isn't the Chinese, but the Chinese mapped it. And meridians are channels of energy that run through the body. They're actually measurable. You find that places on the body that have a lower level of electrical resistance. There are places that where points come close to the surface of the body that we can access, and we actually touch them while we're talking about traumatic events. And these are the same points that an acupuncturist would use.
And let me just, so a lot of people, including us as we were eating lunch, were saying, so are we talking about Reiki? Are we talking about chakras? Are we talking about the crystal bowls and things like that?
Mm-hmm.
Okay, so all those sorts of things have some, are they kind of the foundations?
They're all based on energy.
Okay.
Right, so, and that's a pretty big vat that describes energy.
Yeah,
so,
I'm just choosing a few that I've heard of, and I know there's more to it than that.
Yeah.
Okay, so yes, in other words, we are talking about some of these things. These tend to have an effect on people, and science is just now starting to look at them. Would that be?
Science is starting to look at them.
Science doesn't have all the answers. I'll be the first to admit that, but they're actually looking at this now, and they're discovering that there's more to it than just, what would you call it, ritual or legend or myth?
Or placebo.
Or placebo, right. Okay, great. Okay, so we are going to be talking about that, but I would encourage you to keep listening because it's very interesting, and you're going to probably talk about some successes or some particular instances that have shown effective?
Yes.
Okay, all right.
Yeah, the research on this in the whole field of energy psychology has really come a long way recently. So, of course, studies don't prove anything or disprove anything, but the evidence seems to indicate that there's something going on here that's more than just chance or placebo. So, acupuncturists have been using the meridian system for thousands of years, literally. And so we find that when we access that meridian system while we're processing a negative event, that the emotion can lose a lot of its charge. So we don't remove people's memories, but what we do is through our techniques is decrease the emotional charge associated with a painful memory. And so that helps people to function more effectively in their lives.
And so would you give us the example that we talked about over lunch then? Because I thought that was a good example about can it be a trauma that I experienced both as a child or an adult? It doesn't mean that just childhood trauma, right?
The childhood traumas, when we treat the childhood traumas, there's a greater impact. So, for example, if a client comes in and they're having difficulty connecting with their spouse, I have a difficult time feeling intimate, feeling close. And so we might talk about that and I might ask them, is there a time in your life when you can remember having similar feelings to what you experience now when you try to move in close? And it takes some time, it takes a little investigation to come up with some of these things, but then a client might say, yes, I do remember something similar, where when I was a kid and I tried out for the baseball team and I didn't make it. And I went home and I was on my way home and I was feeling bad and I was hoping that I could tell my parents and that I'd get some sympathy and get some encouragement from them. And so when I walked into the house and my dad was sitting there and I told him that I didn't make the baseball team, instead of comforting me, he said, well, what the hell is wrong with you? And that hurt. There was a lot of pain associated with that. So through those kinds of things and then an accumulation of similar events that might occur, then we kind of develop this fear of intimacy or fear of closeness. And so by asking the client to relive that event in a very controlled and a very systematic way, we're not trying to re-traumatize people, we start to manage the emotion associated with that, and through various tapping procedures, we get to decrease the amount of energy that comes in.
Before we get to that tapping procedures thing, so I thought that was interesting too, is that you don't want to re-traumatize people, but some people might say, well, it was a trauma, but I can still talk about it. I don't like it, it makes me uncomfortable, but I can talk about it. And others, you were saying, they'll get so distraught that you have to stop because it's more than they can handle.
Right.
Okay, so we're talking a pretty broad spectrum, but in any case, it doesn't have to be horrid trauma to be effective with E.F.T.
Correct.
It can be along a very broad spectrum.
Well, we have to think in terms of trauma being relative. So an event that occurred to me when I was 5 years old may have seemed really traumatic, something that I couldn't handle, something that was sudden, something that was unexpected. That as an adult, I look back on it and go, oh, you know what, that really wasn't such a big deal.
But it got you badly calibrated, and you've suffered the effects all along.
Correct.
So you're going to address that, even though it wasn't a big thing. Or I could see my mother brutally murdered in front of me when I was 17, and it could either way. I can deal with those, like you say, the relative and the spectrum. Okay.
Yeah. So we've got to talk about what trauma is, and you don't have to have your leg blown off in order to be traumatized. There's lots of other much less severe events that can be considered traumatizing.
Okay. So we're going to talk about the tapping now?
Yeah, the tapping, it's like you want to keep in mind that, it can look silly. And I'm a big skeptic. I started out being very, very skeptical about all this stuff. But as I started to work with the technique on myself, and then I started to become trained in it and studied it, and started using it with my clients and starting to see the results, where before it might take years working with somebody to effectively manage their anxiety or their depression, now it's looking more like months. So I would ask someone to tell me about a specific event in your life, a bothersome event, something that occurred in a 1 to 3 minute time frame. And I'm going to have you start at the beginning and move through it slice by slice. We're going to take each piece of it, and anytime there's any kind of emotional disruption, I'm going to ask you to stop.
So if we were using the baseball team example, and let me know if I'm doing it wrong. So it's like, okay, well, and then Dad said, what the hell's wrong with you? And then what are you going to do? What are you going to ask me next?
I'm going to say, what are you feeling right now as you remember that event?
Oh, I get angry about it.
You get angry about it, yeah. And I'm saying, well, on a scale of 1 to 10, how angry do you feel right now?
A 6.
6. So I'm going to have you start tapping on the side of your hand.
You want me to what?
Tap on the side of your hand, right here. 4 fingers, right on the side of your hand.
Like
Yep.
this?
There's 2 meridian points there on the side of your hand.
Okay.
So we're accessing those right now. Okay, and I'm going to have you repeat after me. So even though I feel really angry.
I feel really angry.
My dad yelled at me.
My dad yelled at me.
I was expecting him to comfort me.
I was expecting him to comfort me.
I really wanted a hug.
I really wanted a hug.
Instead, he said, what the hell's wrong with you?
Instead, he said, what the hell's wrong with you?
And that makes me angry.
That makes me angry.
And I accept myself.
And I accept myself.
Deeply and completely.
Deeply and completely.
Okay? Tap on the top of your head. Feeling this anger.
I'm feeling this anger.
I told you it was silly. Tap on the inside of your eyebrow. Feeling this anger.
And say feeling this anger?
Yep.
Feeling this anger.
Yep, you're staying in tune with that anger. Tap on the outside of your eye. Feeling this anger.
Feeling this anger.
Under your eye. Feeling this
Feeling this
anger.
anger.
Under your nose. Feeling this
Feeling
anger.
this anger.
Under your lip. Feeling this anger.
Feeling this anger.
Yep. Under your collarbone points. Yeah, you're going to go a little bit lower than where you are right there. There you go, right there.
Feeling this anger.
Yep, and finally under your arm, feeling this anger.
Or saying that I'm a monkey, right?
Or saying that you're a monkey, feeling this
Feeling this
anger,
anger.
right? And then we'd stop. Have you tune back in.
Right. Tuning back in meaning
Tune back,
just like
tune
see
back,
how I'm
tune
feeling
back into the
relative.
story. Tune back
Oh,
into what
okay.
you're feeling.
All
Now
right.
tell me what's now after you rated your anger, for example, level
Right.
7 when we started. What is it now? And
Oh,
and,
okay.
and typically it comes down. Strangely, it comes down. Unexplainably, it comes down.
Okay.
So If it does happen to go up, which sometimes that does happen, then we're looking at probably other factors that are coming in. What else is coming into play here? And somebody else will say, yeah, you know what, there was this other story that was even more significant. We say, okay, well, let's look at that.
That reminds me of another story that's even better or worse, as the case may be, as the one that I chose to share first. Okay.
Yeah. So again, you've got to look at this in context. It can look really silly to see somebody tapping on various parts of the body,
At
but
least to us in Western culture.
yes.
What cultures do not find it to be unusual? If I
Well,
may ask?
EFT is new. It's only about 20 years old, so
Okay.
there haven't been a lot of cultures exposed to this in particular.
Okay.
But there have been, lots of cultures exposed to different variations on this.
And I may be going off topic just a little bit. I mean, is there a particular culture that has been in the 20 years that they've found to be more susceptible to it than others, or people that are less susceptible?
Means susceptible in terms of how they
Just their
respond to
cultural
it.
Background, like would have it like do Chinese people react better to it than I'm trying to think who would than like Hasidic Jews or something like that. You know what I mean?
I don't know that that's happened, but
Okay, I just
yeah,
wondered about
I think
that.
it's pretty cool. You don't, and the great thing is you don't even have to believe it.
Yeah.
Right?
You're saying
you just, it's just like, yeah, just tap with me. And I've done that with clients too,
And
without
so,
even
do I meet
explaining.
with you for an hour? Is it like a typical
Typically,
period
uh-huh.
of time? So you meet with an hour, and then do you deal with just one trauma at a time, or do you deal with the overall person that you're presented with? Like my wife and I was like, I'm afraid of intimacy or whatever, whatever's going on with that person, and then you just deal with. Like, if I only tell the story about baseball all the time, or do you try to see if there's more to it, or can you tell if I tell the baseball story, but can you sense it's like, well, I can see that seems to be a legitimate thing, but I also think maybe it might have something to do, then like, oh, well, yeah, there was baseball and the fact that my dad murdered my mom in front of me when I was 17.
Right.
You want me to talk about that too? I mean, does that happen, or?
It absolutely does
It does,
happen.
okay.
Yeah, I had a man the other day who was talking about being bullied on the bus in school, and suddenly it turned into some childhood sexual abuse that he had experienced. So it was like, whoa.
Did he even realize he was holding back, or was he just not? Was that a matter of getting comfortable with the therapist, or was that really him actually not being fully conscious?
He claimed that he didn't remember that until we were working on it.
Yeah.
And then it suddenly stopped, and he's like, I've got this other thing that I need to talk about.
So you've said that you can get results that are much more rapid than it would have taken in other conventional means. So I would presume that there are some people that take longer or shorter than others, but is there kind of a general period of time that you've seen with EFT people?
There really isn't. It depends on what's going on and how receptive the person is.
What determines how long then you feel that the treatment is appropriate? What are you looking for to say, all right, I think that we've gotten about as far as we can, and call me back if you have a relapse, but we are good to go. What do you look for?
When someone comes in, I'll ask them to evaluate or to rate their scale of discomfort with regard to anxiety, for example. So somebody comes in and says, yeah, I've got all this anxiety going on in my life. I might say, on a scale of 1 to 10, how bothersome is this anxiety? How much does it affect your daily life? And they'll give it a number, and I'll record that. And then we might have a few sessions, and then I'll say, tune back into this general idea of anxiety in your life, and on a scale of 1 to 10, how much does it bother you?
Well, this question comes up, and I'm not being facetious when I ask that, but if somebody came in and said, I've got a lot of anxiety, and over the course of talking to me for maybe an hour or two, whether it be 2 hours at one time or 1 hour 1 week, and I say, yeah, I've got a lot, well, and you find out that my anxiety is because I like shoplifting.
Mm-hmm.
Okay, is that a trauma? That would not be a trauma, right?
That's not a trauma.
Right.
No.
So then you would say, hey, look, EFT is not your problem. It's you got to stop shoplifting.
Well, then we'd say that shoplifting is now a new tabletop, as we call them in EFT, right? So that's an issue, shoplifting.
So in other words, if you can see that there are behaviors that I've got to change, you would point that out. And would you then help me with that, or would you refer me to somebody else?
Oh, no, I'd help you with that.
Okay, so you'd help me with that. Yeah. So when you're talking about the anxiety, it's like anxiety that's come from my past that I've got to address now, as opposed to stop shoplifting, right? Is that what you're saying? Do you see where I'm coming from?
Yeah, I mean, the shoplifting might be causing me anxiety.
It is,
right?
But you're rather than me. And again, I'm not me. But you wouldn't say start tapping. It's like just stop shoplifting.
No.
You would. Oh, okay. What would you do?
Why are you shoplifting? What's going on? Shoplifting.
Okay. All right. So what you'd say is yes, the shoplifting's bad. But now we're going to explore the underlying trauma behind that.
So shoplifting itself might be a response to the anxiety. What is it I'm trying to distract myself from with this shoplifting thing that I've got going on? If I stop shoplifting, what's going to come up? What am I going to notice? What am I going to find out about myself?
So I stop shoplifting, and then I find out that there's another trauma that I've dealt with at some point in my past that's giving me, it's making it hard for me to deal with life. And so when we work on coming to grips with that, for lack of a better term.
Mm-hmm.
All right. So is this something that is covered by insurance?
Well, my services are covered by insurance.
Okay.
And this is one of the tools that I use.
All right. And must you use your health insurance for something like this? If somebody, because I know that when I talk to a lot of therapists and counselors, there are many people that say, I'd really like to get some help, but I don't want anybody to know because I'm afraid I have enemies that will use it against me or that people will misjudge me. So can people also just pay on a cash basis as well?
Absolutely. Happy to accept cash.
Do you keep records that could be subpoenaed or that might fall into the hands of my political enemies and stuff like that?
I'm required professionally to keep
So
records.
people do need to know about that, right?
Mm-hmm.
And how much does it cost per session?
My sessions are $120 per 50-minute session.
All right. And you're not in a position to say, it's like, well, can we just use averages then? What's the average number of visits people use? Again, knowing that everybody's different, but on average, how long do you see a patient? Do you call them a patient, a client? What do you call them?
You know, it's client, if you take it back to the Latin roots, turns out to be a master-slave relationship.
Oh, really? Okay.
Right? The word patient just means someone who suffers. So most people refer to people as the people that they work with as clients, but I've started to shift it more over to patients because that seems more appropriate.
Okay.
Right?
And so a patient spends, on average, how much time with you?
About 50 minutes.
Oh, I'm saying
over the course of time?
How many sessions?
Wow, that varies a lot. That'll vary from 5 to
Fair enough.
3 years.
Okay.
Right?
All right. Well, this has been very interesting. And like I said, I think more so than some of the others because this is different than what I've talked about, but it all falls into the same category. A lot of us are familiar with some of the talk therapies and things like that, but this is a little bit different, a new wrinkle, and I appreciate you coming and talking to us about it and doing such a good job of laying it out in a short period of time. So if you'd like to know more about this and we haven't been able to cover everything, before we go, give them your contact information one more time if you'd be so kind.
All right. So my name is George Limberakis, and the website is georgelimberakis.com. Phone number is 801-487-4298.
Oh, and where are you located?
I'm located just out on the outskirts of Sugar House, so right near Liberty Park.
Okay. Thank you so much.
You're welcome.